So I was recently asked by a cardiologist to speak on how bariatric surgery improves cardiovascular disease or heart diseases. So I did a lot of research and found out, and I'm going to share this. So first thing is, even if your BMI is 25, you have a heart problem, you are told to lose weight because this is considered a very important factor in terms of your heart health. And when you do diet and exercise, you can lose weight, but most of them are not able to maintain for more than 1 year. So they are actually not very effective for most of the patients. But what happens after surgery? Now, the figure on that side is that there is a 37% weight loss at 1 year, 37% of your total weight. So if you are 100 kgs, you are likely to lose around 37 kgs. Okay. And if those same patients are followed long term, that is 15 years, they are still lost 31.5% after 15 years. So this is important, like Farida was saying that she gained weight, but gain, lose, and you are still at least minus 30% weight loss even after 15 years. So this thing will continue. This thing continues even if you had no surgery, you would be maintaining at zero level where you were before surgery. But here you are maintaining even after 15 years with 30% weight loss at least. Okay. And if you have a bypass surgery, then you lose about 45 kgs weight in first 2 years, and even after 12 years, you are still lost about 35 kgs. So it's very easy to say that you gain 10 kgs, but imagine that even after 12 years, you are maintaining at least 35 kg weight loss. So this is important to realize that gaining few kgs is not wrong, but you should become careful and then you can try to maintain it. What about diabetes? So recently in one of the conferences, a dietitian stood up and said, "Sir, you are saying you treat diabetes, but I saw one patient who developed diabetes after bariatric surgery." Okay. I completely agree. But in this study, now these are all publications, 12 years after surgery, those patients who had surgery, only 3% of them developed diabetes, new diabetes. While 26% of those patients who did not have surgery, same type of patients, developed diabetes. So this prevents diabetes. This is not a question of treatment. Even those who don't have diabetes, who have just obesity and we are operating them, almost 23% less chance that they will develop diabetes, new diabetes. Okay. Now, what about those who already have diabetes? Some of you are here because we operated you for diabetes. So those patients who will go completely off medicine for diabetes, at 2 years, 75% patients. And even after 12 years, 51% patients are off medicines. So these are the patients who had diabetes when we operated, but even after 12 years, 50% of them will not need medicine. Others are also controlled but with medicine. So that is the kind of impact that is seen. Then on blood pressure, those who had surgery for obesity but did not have blood pressure, 50% of them will not have blood pressure. That means the new patients will reduce by 50% at 5 years. Okay. And those who were on blood pressure medicines when we operated them, after 1 year, 51% are off medicine compared to those who did not have surgery. All of them continued medicine. So for weight, for diabetes, for blood pressure, it is the most effective therapy available on earth, even compared to medicines. Then comes cholesterol. That's 19.8%. So about 20% reduction in cholesterol levels after 1 year of surgery. And the healthy cholesterol improves. So healthy cholesterol is seen in 58% patients. And that is 75% lowering of triglycerides. So it is better than your atorvastatin. Some people eat atorva and all those things, statins. 75% reduction in triglycerides after surgery. Okay. When all this happens, there is a condition called metabolic syndrome. Now this is technical. Metabolic syndrome makes us prone to heart attacks. Metabolic syndrome has, if our tummy is big, waist circumference is more, if triglyceride is high, if blood sugar is high, if HDL is low, or if blood pressure is high. Now, for each of these, you have to do different things. For triglyceride, you have to take another medicine. For blood sugar, you have to take other medicines. But when we do surgery, we affect all these 5 things. And because all these 5 things are affected, your heart health improves. So I'll show you how it improves. All of you know what angina is. Angina is chest pain when we do some effort in some patients. So after surgery, those people who never had angina, only 0.4% will have angina compared to almost 2% who did not have surgery. Okay? So the angina possibility reduces by almost 75%. Why this is necessary? If somebody says, why did you have surgery? You should have lost with diet. Tell them that it's not about weight, it's about your health. If the other person is obese, tell them that you are such high risk of angina and other health problem that I'm going to show you. And this is 2/3 reduction in hospitalizations for angina after surgery. So those who already have angina, they will require hospital admission less and less because they had a bariatric surgery. What about the coronary artery disease? We all know that coronary arteries can get blocked. All right. So there is a 32% reduction in coronary artery disease reduction. And this happens because obesity is an inflammatory disease. We all know COVID caused inflammation. Obesity causes inflammation. So the inflammation goes down, adhesiveness of our platelets go down. So, if the platelets get adherent, we get heart attack. And atherosclerosis goes down. So because of this, 32% reduction in coronary artery disease. And because of this, there is a 47% reduction of heart attacks. All right. So just because you had bariatric surgery, now this is not about weight loss. This is something beyond weight loss. We are talking of inflammation, adhesiveness, many factors. I have removed all this. I am taking a oration this month only in Kolkata on this very topic. So it's very technical, but for you, I may try to make it simple. But almost 50% reduction in risk of heart attack for those who had surgery. Then there is something called heart failure. Heart failure is when the heart is not pumping enough. All of you had a 2D echo done. All right. So if heart is not pumping blood well enough, you get breathless when you walk or you do exercise. We recently operated a patient. Is Mr. Kothari here today? No. His heart function was only 20%. And the cardiologist sent a young man from South Mumbai only. Cardiologist got the surgery done because there is nothing else that can improve his heart function. So if you do this surgery, those people who never had heart failure, the risk will reduce by 5 times in surgical patients. All right, who never had heart failure, like most of you. But those who had heart failure, there is a 40% reduction in heart failure episodes. So it works both ways. It prevents and it treats. It prevents and treats. That's what I'm trying to show you, that it works both ways as far as heart problems are concerned. There is another problem called atrial fibrillation, when our heart beats very fast. Now, I remember one of our patients had it in Chembur, and we had to postpone it, the surgery, and then we reoperated after cardiologist managed him for a few days. So there is almost 90% reduction of heart failure, atrial fibrillation in those patients when we do this surgery. And for each of these, there is a technical reason. It's not about weight loss alone. Then what happens to those, because if we are talking a heart attack, the same thing happens when we have a brain stroke, that blood supply gets cut off. There is a 32% reduction in brain strokes in those patients whom we operate, do bariatric surgery. So it's not necessary that you have a brain stroke problem before surgery. You just came to us for obesity, but then in long run, there is a 30 or 32% risk which goes down for brain strokes. And because of all these things, we can say that there is almost a 50% reduction of cardiovascular disease or heart attack and brain stroke both together. Now, this is the deaths because of the heart attack and the brain strokes, 50%. So, when so much is happening, why surgeries, why physicians are not referring patients for surgery in large numbers? No, it's not this. It's not. It's just ignorance. It's not. It's lack of awareness. Like this data just came back about one of the publications that I mentioned is published in September just last month. Because to prove something like this will take 20-year follow-up. So if you had surgery now, I have to follow all of you for 20 years, then I can prove how many of you had heart attack or not. And I have to have a control group who did not have surgery. So it's not easy. This study has mostly come from Sweden, where they have a registry, national registry. And they have patients who had surgery and the patients who were denied surgery because they did not have an insurance. And they followed all these patients for 20 years and they found out that those who were denied surgery, how many of them had heart attack, how many of them died because of these problems. So now we are able to prevent and treat obesity, diabetes, blood pressure, metabolic syndrome and heart disease. But it's not a small number. We are doing about 20,000 surgeries a year in this country. It's not my number. It's all the bariatric surgeons together. All right. And it is safer than a gallbladder surgery or a hip replacement surgery. Okay. And obviously, those centers who are doing only bariatric surgery and in large number, the quality of care is definitely better.